Hello students, discussing about what are assess the nutritional state and targeting motion and the dietary assessment of nutritional status is one of the first steps of any public combat malnutrition. Of such an assessment, the type, magnitude of malnutrition in areas, the at-risk groups, the contributory factor. Assessment is action of both objective data related and nutrient intake and medical history. Data on an individual is organized and the assess and evaluate of that particular nutritional status of the result of matters. It is adequacy of food intake of quality and also by the physical that particular individual nutritional status of a community of the status of that community. Now let us discuss the various methods of nutritional assessment. They are categorized into 4 types, which is called the ABCD approach. We divide the nutritional status of an individual into 2 major categories, the direct and indirect method. The direct method includes anthropometric measurements, biochemical tests, clinical examination, whereas the indirect method includes dietary assessment and vital health statistics. Anthropometric measurements include like measurements of height, weight, mid-upper arm circumference, head and chest circumference, BMI, which is body mass index, and also the waist to hip ratio. If there can be sometimes no accuracy in the measurements if the measuring instrument which is used is not properly calibrated. So care should be taken that the instruments are calibrated regularly in order to give accurate results. The biochemical assessment include both blood as well as the biochemical tests. Blood tests like hemoglobin, urine and stool examination. Then the various biochemical tests include the kidney function tests, we have the liver function tests, the blood cholesterol, blood lipids, the blood sugar tests, etc. Each part of this approach is important because no single parameter alone directly measures the individual nutritional status or determines the problems and needs. Each assessment has strengths and limitations. So, careful selection and skillful use of combined methods together with their interpretation according to the standard references for age, sex and personal situation are all essential for a quality nutritional care. Nutritional assessment is basically used to identify malnourished patients, also to identify patients who are at risk or becoming malnourished. It also provides data to serve as a basis for planning any nutritional support to correct or prevent malnutrition. It provides information for effectiveness of nutritional support. Now we will see how clinical examination and dietary information affects the nutritional status of an individual. Clinical examination assesses the various levels of health of an individual or of a population groups in relation to the food they consume. It is the simplest and practical method. Careful attention to physical signs of possible malnutrition provides an added dimension to the overall assessment of general nutritional status. When two or more clinical signs are characteristic of a deficiency disease are present, then their diagnostic significance is greatly enhanced. Clinical assessment consists of a routine medical history and a physical examination to detect physical signs and symptoms. Now let us understand how clinical examination and dietary information will help to assess the nutritional status of an individual. Clinical examination assesses levels of health of an individual or of a population groups in relation to food they consume. It is the simplest and a practical method. Careful attention to physical signs of possible malnutrition provides an added dimension to the overall assessment of general nutritional status. When two or more clinical signs, characteristics of a deficiency disease are present, simultaneously their diagnostic significance is greatly enhanced. Clinical assessment consists of a routine medical history and a physical examination to detect the physical signs and symptoms. Like for example, a symptom of muscle wasting is mainly due to the deficiency of energy. Premature whitening of hair can be due to the deficiency of selenium in the diet. Spooning of nails is because of deficiency of iron. Impaired night vision is because of vitamin A, so on and so forth. For clinical examination, cooperation of the subject can be achieved easily because the procedure is non-invasive and the symptoms are observed externally. This method is a reliable and very easy to organize. The age of the subject need not be ascertained. Symptoms are specific to a particular nutrient deficiency. This method is not very expensive and it does not require elaborate apparatus and reagents. However, it requires an experienced investigator to assess the symptoms. The early clinical symptoms and signs of malnutrition are rather vague and often include weakness, lethargy, irritability, and lightheadedness. Many of the symptoms and signs are non-specific for a single nutrient and may be caused by insufficiency of one or several nutrients. For example, flaking dermatitis, which is mainly due to the deficiency of protein, riboflavin, and linoleic acid in the diet. Some symptoms like angular stomatitis may also be due to several deficiency. Changes in conjunctiva, lips, and skin can be caused by non-nutritional factors like cold, dryness, irritation, and infection. In a well-nourished community, signs of malnutrition are infrequent and so more easily overlooked and misinterpreted. Now let us see what are the various dietary assessment methods which you can use to analyze the nutritional status of an individual. A diet survey provides information about the dietary intake, patterns of specific foods consumed, and estimated nutrient intakes. It indicates relative dietary inadequacies, which is helpful in planning health education activities and changes needed in agricultural and food production. Most of the time, the surveys are carried out for 7 to 10 days. If needed in different seasons, surveys can be repeated. The first method is called the inventory method. Now, this method is often employed in an institution like hostels, army barracks, orphanages, and homes for the aged, where there are homogeneous groups of people who are taking their meals from a common kitchen. In this method, the amounts of foodstuffs issued to the kitchen as per the records are maintained by the warden, who is taken into consideration. No direct measurement or weighing of food is done. a reference period of 1 week is desirable. This method can also be used for assessing food consumption at household levels, provided the respondent maintains a regular record of the food that has been taken. There is a formula with the help of which you can calculate the average intake per person per day, that is, the stocks at the beginning of the week minus the stock ending of the week divided by the total number of inmates per person who is taking the meal and the number of days of the survey. Though a large sample can be covered in a relatively short time, active cooperation of the respondent is very necessary. This method is possible only when the community is fairly educated and subsists on cash economy, where food is usually purchased from the market. The second method is called the weighment method. In this method, food is either raw or cooked is actually weighed using an accurate balance. It is ideal to conduct such a survey for a period of 7 consecutive days to know the true picture of the diet. Every day the food is weighed in the morning as well as the evening before actual cooking is begun by the housewife. Only edible portion of the raw food is weighed. All the family members who consume their food, the age, the sex, the physiological status should be noted down by the individual. Consumption of food by guests and additional food consumed by the family members, like those who brought food in a cooked form, sweets, and food accepted from friends and relatives, should also be noted down with the details. Survey should not be done on fast or festival days. Foods are then converted to nutrients by referring to the food composition tables. The nutrient intakes thus can be expressed per consumption unit or per capita. Though weighment method is relatively more accurate as it involves direct weighing of foods, it is time consuming and needs cooperation of the housewives. Sometimes housewives do not cooperate, or they may exaggerate or underestimate the food consumed. All the food may not be eaten on the same day. The investigator has sometimes have to stay in the village or the place where the survey is being conducted. The third method is called the food frequency method. This method is useful for obtaining qualitative details of the diet and also studying the patterns of food consumed per household or at an industrial level. The procedure includes assessment of the frequency of consumption of different foods daily or the number of times in a week or a fortnight or occasionally. This method has been used to study the meal pattern, the dietary habits, people's food preferences and avoidances during the physiopathological conditions like pregnancy, lactation, sickness, etc. Even during infant weaning and breastfeeding practices. And it is associated with cultural constraints which are often prevalent in the community and can also be studied by this method. The fourth method is called the oral questionnaire method, which is commonly practiced by most of the dietitians before they plan a diet for an individual. Now this is a 24-hour recall method, and in this method a oral questionnaire, diet survey, a set of standardized cups suited to the local conditions are used. Information on the total amount of food that is cooked for each preparation is noted in terms of standardized cups. The intake of each food item by the specific individual in the family, such as the preschooler, adolescent girl, or a pregnant or a lactating mother, is assessed by using the various standardized cups. The cups are also used mainly to aid the respondent who recall the quantities prepared and who are fit to the individual members. So these were the different ways of dietary assessment, which are commonly practiced in order to know the dietary intake of an individual. Therefore, nutritional assessment is an integral part of patient care, since nutritional status affects a patient's response to illness, and nutritional screening is the process of identifying any characteristic deficiency which is associated with the nutritional problems. Its purpose is to identify an individual's risk to malnourishment, and it is an in-depth evaluation of both objective and subjective data related to an individual's food choice and nutrient intake. It also reflects to the lifestyle and medical history. Once the data on the individual is collected, it is organized and it is assessed and evaluated to assess the nutritional status of an individual or a group. It leads to a plan of care or intervention, and it is designed to help the individual either to maintain the assessed status or attain a healthier status. As we had previously discussed, there are 4 different types of assessing the nutritional status of an individual, which include anthropometric measurements like head and chest circumference, height, weight, BMI. Then we also have biochemical analysis or tests. We also have discussed about the clinical examination, which forms an integral part, and finally the diet survey. We have discussed the 4 different ways how we can assess the nutritional status of an individual based on the oral questionnaire or 24 recall method. Finally, the practitioner uses these anthropometric data to assess the ideal and desirable weight, and also the clinical, biochemical and dietary data which is used to assess the nutritional status of an individual. And a nutritional intervention which includes dietary guidance and exercise recommendation is finally formulated and discussed according to the individual's requirement. I hope you understood the importance of clinical examination and dietary assessment to assess the nutritional status of an individual. Each part of this approach is important, and it does not work singly. It works as a group in order to determine whether a person is at risk of malnutrition or not. Of course, each assessment has its own strengths and limitation. Therefore, careful selection and skillful use of combining the methods together is very important to analyze the nutritional status of an individual.